Forbes.com. Will AI improve healthcare? Consumers think so. New surveys show. By Deb Gordon. Artificial intelligence AI promises to transform everything from basic to college admissions. And this week, AI filled the news cycle with corporate intrigue when OpenAI fired and then apparently rehired its co-founder and CEO. But what will AI do for healthcare? And how do consumers feel about it? That's the subject of two recent reports. The short answer is that despite reservations, consumers are see upside. Many have high hopes for AI to improve healthcare. According to new survey results from the Deloitte Center for Health Solutions, about half, 53% of consumers surveyed believe generative AI could improve access to healthcare. Another 46% says they think it could make healthcare more affordable. These figures were even higher, 69% and 63%, respectively, among respondents who reported already using AI. The Deloitte survey was conducted in the fall of 2023 with a national representative sample of more than 2,000 U.S. adults. The majority, 84% of respondents, had heard of generative AI, and 48% reported that they are already using it. Health and wellness was the third most common reason respondents reported using AI, after fun and work tasks. Specifically, 19% of respondents who are using AI for health and wellness said they use it to learn about specific health conditions. Nearly as many said they use it to research treatment options, 16%, or to understand medical or health insurance terms, 15%. Respondents without health insurance were more likely than insured respondents to report using generative AI for healthcare purposes of 47% compared to 38%. Uninsured respondents were more likely to use generative AI for mental health support, 17% vs 10%, to find a healthcare provider, 13% versus 9%, and to get recommendation about medications to ask a doctor about, 10% versus 7%. These discrepancies may suggest that AI is filling gaps, uninsured people face in accessing healthcare and health-related information. They also illustrate how important it is that generative AI provides reliable results. Which most consumers who use it believe it does. The Deloitte survey showed that 69% of respondents using AI for health-related purposes find information they get to be very or extremely reliable, and just 5% say the results are not at all or not very reliable. The balance are neutral. This confidence may not always be well-founded, according to Seth Bilfera, MD, a principal at Deloitte Consulting, LLP, who contributed to the report. Consumers should be careful with over-reliance on generative AI tools at this juncture, as should always validate finding with a clinician. Fair said, many models have been shown to be propagating bias, so customers should always be aware of potential bias until we can remediate and eliminate the bias. Despite the limitations, consumers who have used AI related to health or healthcare tended to be optimistic about its potential. 71% said they agreed that generative AI could revolutionize how healthcare is delivered, compared with 50% of respondents who haven't used AI for health reasons. Some of consumers' optimism, I believe, comes from their desire for more personalized healthcare experiences. Farah said they see generative AI as increasing personalized access to the healthcare system with automated personalized follow-ups, motivational nudging tailored to them, and appropriate triaging for imitate needed to the appropriate level of care, whether it's an instant virtual visit versus an in-person office visit or a need for urgent care. Farah suggested that generative AI may be especially well suited to administrative simplification tasks between health plans, providers, and consumers, such as billing transparency, to clarify consumer financial responsibilities. That's what consumers want as they take greater control of their healthcare, he said. The survey showed that consumers are comfortable with AI to inform them about new treatments when they become available. 71% help reviewing and interpreting left 66%, and imitate imaging results 62%, determining the best treatment and medication for their condition 58%, determining the urgency of their need for treatment 54%, and diagnosing their condition 51%. That comfort with AI depends on key factor transparency. 83% of respondents said that it's very or extremely important that their healthcare providers disclose when they're using generative AI for treatment or clinical support. This finding is consistent with a previous survey conducted by Carta Healthcare, a clinical data company. In that survey, conducted with more than 1,000 U.S. consumers this fall, 80% said that knowing if their healthcare providers is using AI is important to improving their comfort with it. Overall, in the Carter Healthcare Survey, 3 out of 4 respondents said they don't trust AI in a healthcare setting, but levels of trust varied widely by generation. 61% of millennials said they trust the use of AI in healthcare. On the other hand, 62% of baby boomers and 54% of Gen X respondents do not. 1 in 4 respondents said they believe AI would provide better information than their provider, and 60% said they think AI could ease the burdens created by healthcare labor shortages. On the less positive end, a majority, 63%, worried that AI would put their healthcare data at risk. At the same proportion, worried that AI would lead on to get less time with their provider. The Carta Healthcare Survey revealed some confusion about AI. Nearly three-quarters, 71%, said they don't know if their provider uses AI tools, and 43% admitted their understanding of AI is limited. They're open to learning more, though, with 47% reporting that if they understood it better, they'd be more likely to trust it. Two-thirds, 65%, also said that an explanation from their healthcare provider would make them more comfortable with their provider's use of AI. We are entering an exciting phase of accelerating evolution in artificial intelligence. Farah said that future will be extremely bright if we proceed with the appropriate transparency and trustworthy frameworks that support and elevate critical thinking for human beings who remain in the middle of complex, sensitive tasks and decision making.